we need kind of the public sector to hopefully stop doing things like stripping away public health emergency powers from state public health agencies. But we also need the private sector to help, candidly, like do a better job of helping explain kind of the science that you are already commercializing and bringing to market, but also what you're working on, and help us kind of in the broader conversation not be uncomfortable with the discomfort of uncertainty. And so I do think we need really good ideas for how best to do that, because we all deserve to hopefully not be as unprepared as I worry we are at the moment. And the last thing I'll say is a new effort that we're a part of is the new initiative launched by the World Health Organization last week to try to catch kids up on their routine immunizations.
If you have any shame or conscience at all, you've, already turned your back on the ineffective and not safe jabs, but now come the Clintons, right on cue, to take Big Pharma and Bill Gates' money to push more jab propaganda. They're calling it the big catch-up, and it has some of your favorite global supervillain organizations, such as the WHO, UNICEF, the Vaccine Alliance, Bill and Melinda Gates Foundation, and now the Clinton Global Health Initiative. They're all focusing in particular on the 20 countries, according to the press release, where 3/4 of the children miss routine vaccinations in 2021. The press release also cites growing vaccine hesitancy that resulted from the COVID pandemic, without, of course, acknowledging the valid concerns of people due to the ever, quote-unquote, evolving science and total outright falsehoods peddled by so-called medical and public health experts. In fact, according to this recent Morning Consult poll, over 1/4 of Americans are skeptical to some degree about vaccines in general. And joining us now to discuss this new mass vaccination push is Dr. Mark Sherwood, who heads up the Functional Medical Institute with his wife, and is a former Oklahoma gubernatorial candidate and SWAT team member. Welcome, Dr. Sherwood. It's good to see you. Thanks for being with us.
You're welcome, Emerald. Thanks for having me. Very important topic here we got to talk about.
Yeah, but I'll be honest, Dr. Sherwood, anytime I hear the Clinton name in the same sentence with children, I'm a bit weary. So what's your thoughts as a medical expert, a real one, a doctor, on this new partnership and initiative?
Well, like you, I am chasing dollar signs as clues with this one, no question about it. The skepticism that's been created has been created by the system itself. That's one of the blessings and the big, huge victories that came out of this COVID thing, the skepticism. I think now people are starting to think for themselves, and that's a good thing. That is a brilliant thing, and that's a God-centric thing. At the same time, it's interesting that even Joe Biden, the pretender in chief, is one that said, certainly, if you take the jabs, you won't get sick. Well, that was false. So, and I find it interesting that, Chelsea Clinton, of all people, what makes her the expert other than her name? And so we have got to start going through this process step by step. And to talk about preparedness, why doesn't somebody talk about preparing our world against the calamity of obesity and type 2 diabetes that's destroying the foundation of multiple children across this globe?
I absolutely agree, and that doesn't enter the conversation at all. And even it feels that there is not a focus on a healthy lifestyle, be it children or adults. It's more on the pharmaceutical solutions to whatever symptoms you have, and this just seems a continuation of that. And well, of course, when we're talking about Bill Gates and Melinda Gates Foundation as well, they focus on certain countries. I have to ask you, though, Doctor, have we seen an uptick in any of these diseases that the childhood vaccines supposedly keep from happening due to, there has been, I know even in our country, there's been some parents stepping away because they're concerned about what now might be in the vaccines that are part of the regular childhood schedule, not to mention the COVID vaccine, that might have changed and they haven't been notified.
Yeah, great question. So let's look at this. The CDC has now nearly 70 vaccines that they have said are okay. Has our health got better or worse? Well, I think people on both sides of the discussion would say it's gotten worse. So I think unequivocally we can say the vaccines have not helped with overall cause and effect of disease. Now, having said that, there's no discussion again about natural immunity. Natural immunity is great. You go back to the Revolutionary War, and even back when George Washington was leading that brigade, little people know that he actually mandated the smallpox vaccine for the soldiers that had not already been exposed to it and got over it. So even he understood the blessings of natural immunity. And again, those things are not in there. So I think overall, it is literally absurd. It's a mixture of data. It's a mixture of facts. It's a mixture of innuendos to try to create a point. And this is the thing that people do in mainstream media. And I'm grateful for you to bring out the idea of, let's call it a heavens advocate side, to give people the opportunity to begin to think again for themselves, which is, again, is a wonderful blessing that we have.
Yeah, and I too am encouraged that more people are finding information, questioning the narrative they're being fed, because it's the only way that we'll get back to any reason. And also listening to medical experts like yourself who didn't push the falsehoods or the jab propaganda throughout the COVID pandemic and treated so many patients with good outcomes with real medicine and therapeutics. Thank you so much, Dr. Sherwood, for joining us today. We'll have to keep an eye on this partnership, because sometimes you don't know what they're really doing until much farther down the road. And I have a feeling we'll be talking about this again, Dr. Sherwood.
I think we will. There's such a thing, Emerald, as marriage made in heaven, like my wife, Dr. Michelle, and I. And then there's such a thing as marriages made in hell. And that's exactly what we're dealing with. And evil will be the only thing that is coming from that.
Yeah, I'm afraid so as well. Thanks, Dr. Sherwood. Always good to see you.
Good to see you too. Thanks for having me.